Our next workshop will be presented by Brandon George, who is the director of the Indiana Addictions Issues Coalition, Justin Beatty, who is manager of the Indiana Association of Peer Recovery Supports, and Heather Rodriguez, who is the manager of the Indiana Recovery Network. These programs are part of Mental Health America of Indiana, and we are embarking on a groundbreaking project in response to the COVID-19 pandemic. The focus is on the increasing numbers of those needing recovery supports during this time. The Regional Recovery Hub project allows for anyone who is in need of recovery supports to access a recovery coach or recovery specialist. Please welcome Brandon, Justin, and Heather.
Greetings, everybody. Thanks for joining us today. My name is Brandon George, and I'm the Vice President of Recovery, Advocacy, and Programs for Mental Health America, Indiana. I'm grateful for the opportunity today to talk about one of our most exciting programs, the Indiana Recovery Network's Regional Recovery Hubs. We're excited for this for a variety of reasons, but for me specifically, what it's going to do to our treatment and recovery systems. For the longest time, we have used the term treatment and recovery very interchangeably, or we've relied on the treatment industry to have a piece of recovery in there. And what we found out over the last 5, 6, 7 years really is that recovery is a distinct entity from treatment. You know, we look at treatment really as that acute intervention for the healthcare issue. Unfortunately, addiction being a chronic condition, that acute care model doesn't produce the best results. And so having a system that is set up to engage with recoveries for a longer period of time throughout different parts of the system is really, really needed. And so the Indiana Recovery Network is a brainchild of Mental Health America, Indiana, and was funded by SAMHSA for the last several years. What that is it connects all the recovery-based organizations throughout the state, creating a recovery infrastructure. So think about recovery residences and recovery community organizations, recovery coalitions. All of these live in the same space, but were not connected before. And so the Indiana Recovery Network has created a platform in which we can disseminate information, share resources, up-to-date news and relevant topics to those in the recovery community. And this project, the Regional Recovery Hubs, is an expansion of these efforts, where we're going to be able to utilize recovery organizations throughout the state to deliver peer services. The Governor's Office, Next Level Recovery, Division of Mental Health and Addiction, and Mental Health America, Indiana have collaborated to work on this project. Creating recovery ecosystems and communities is vital. As most of you know, the addictions care, addictions treatment has been very siloed off from general health care for some time. Normally, when you have a healthcare condition, you go to your primary care physician or the emergency department, or maybe a 24-hour clinic or a walk-in healthcare clinic. But when it comes to addiction, none of those places are suited to treat this condition. So where's that leave the people seeking care? Often lost is the answer. They are Googling on their phone where to get treatment, and there's not one resource to be able to direct them in the right direction. Well, I'm glad to say that by identifying regional recovery hubs in each region throughout the state, we now have a place where people can go and access a broad range of recovery-related resources. Whether that's getting into a treatment that is truly client-centered, from medications for opioid use disorder to traditional detox or residential facilities, to finding home, healthy places to live, recovery residences, and other structured environments, temporary housing. Connecting with community, recovery coaches, 12-step recovery, smart recovery, celebrate recovery, faith-based groups. And then purpose is the other area that we focus on. providing both educational resources for those in recovery, employment opportunities, and connecting them into workforce initiatives around the state. A key ingredient to this, or critical aspect, is the delivery of peer recovery support services. Proud to have our manager of peer supports, Justin Beatty, playing a critical role in the setup and delivery of this throughout the state through the regional recovery hubs. Having peer supports on the front line enable two things. One, the ability to earn trust from the person suffering from addiction or substance use disorder. Sometimes it can take weeks or months to build trust with somebody. Recovery coaches, certified peer supports are able to do this in a matter of minutes or hours, allowing the client or the recovery to open up and really getting them to where they want to be, not where somebody else thinks they should be. The other benefit to peer support services is that they serve as a liaison throughout this very siloed addictions care world. And so having somebody that can help you get into treatment or with the recovery residents or any of those other recovery support services that we mentioned is vital. And using this community-based model allows these peers to stay with the recovery throughout the journey. Really excited for what we're going to talk about today. Justin's going to talk a little bit more about peer supports, and then Heather is going to go into the details on the regional recovery hubs. Everybody, I hope you enjoy this as much as we do and as excited as we are. Thank you.
Hi, I'm Justin Beatty, Manager of Peer Supports with Indiana Addictions Issues Coalition and Project Manager for IPRIS. One of the things I want to talk about for a minute is kind of the reason why this Regional Recovery Hub project is needed. Some of us aren't familiar with the role of peer supports. What peer supports are generally people with lived experience or people that are advocates for recovery and want to help a person on a self-driven approach to recovery. When we talk about a self-driven approach, what this really means is that the person receiving the services or the person seeking or in recovery is the driver of the process. They are the one who is going to be making all the decisions, and really the peer is just going to help guide them to whatever resources they need or remove any barriers that are required. So when we think about this, historically, the way peers have been used throughout the state of Indiana is that they've been attached to some type of treatment provider or some type of service provider. Well, the issue in these situations is that a person has to go and engage in these services or know that they're available and then start receiving the peer support to really kind of figure out what's going to go on with their life. And the goal with this project was really to have peers as more of a community-based thing. As I mentioned, with peers, we want to have them available to where a person, when they're thinking about anything, whether they need a resource, need someone to talk to, or any of these kind of things, they're able to just reach out. They don't necessarily have to go to an organization. And so with these regional recovery hubs that Heather's going to talk to you about in just a few minutes, this will allow us to really triage a person, really have a conversation with a person and see what their needs are. See what their desires are, see what's blocking them from having positive change in their life. And so then the peer can really look at these situations, have that person-driven conversation with them, and then help facilitate their recovery process by connecting them with resources that best meet that person's need, rather than the resource the person found. And so when we consider these situations and really how to move forward from them, these hubs give the opportunity for anyone, whether they're currently not even contemplating recovery, whether they're seeking recovery or they're in recovery, to kind of have this non-biased, non-judgmental person to sit down and talk with, where that person's just going to simply ask them, what can I do for you? What do you see as being the barriers to your recovery? What do you see as the barriers from you getting any resources you need? And how can I assist with you moving forward? And so as the peers work through people with that, it's really going to be this overarching idea through all of this of connecting with community partners. There's a lot of organizations out there doing amazing things throughout the state. However, other organizations don't know about them. Other communities don't know about them. And as we know, a lot of people that look to engage in recovery or sustain their recovery don't always do it in their hometown. So one of the roles of our peers in our regional recovery hubs is going to be those navigators, going to be kind of those resource brokers of helping educate the person to what all's available and what best might meet their needs. So that way they are getting connected to the services available and not just something they find on a Google search or any of these kind of things. So when we continue to look at this, they're being built out all over the state. So when we look at this, the peers are not going to be providing clinical services. The peer's job is not to treat someone, not to diagnose or provide any of those kind of clinical services. What the peer's role is to help connect that person to clinical services if it's available. And that's where the peer is going to really be looking to partner with all the different organizations across the state and really look at the different things that are necessary. So one thing we want to talk about before we kind of wrap this up and move into what Heather's talking about is really this overarching idea of who's available in the area. And that's where we need you who's watching this to really keep in mind how this program is going to help everybody, how we can move forward with it, and really how by having that community-based approach where we not only meet people where they're at in their recovery, but we're able to meet them where they're at physically, whether it's through a Zoom call like this, whether it's through talking to them on the phone, whether it's other options that are available as social distancing is kind of set in place. We're then able to really look at these things and meet people where they're at. Because as we know, transportation is a regular barrier for people. And so when we can meet them where they're at in their living room, whether we can provide these services in any a multitude of ways, that person's more likely to engage. That person's more likely to be open and honest with someone they think can really relate to them and just wants their best interests looked for. So Heather's going to talk to you now about what's going on with this throughout our state and how we can partner with you or your organizations and how this can benefit the populations you serve.
Hello, today I'm going to be sharing some information with you about Indiana's Regional Recovery Hubs, which is a collaborative effort between the Indiana Recovery Network and Mental Health America of Indiana. The Regional Recovery Hubs have been created in partnership with the Governor's Office Next Level Recovery and Indiana Family and Social Services Administration Division of Mental Health and Addiction. My name is Heather Rodriguez. I'm the manager of the Indiana Recovery Network and manager of Recovery Community Development with Indiana Addictions Issues Coalition. Due to the COVID-19 pandemic, a recovery response effort has been created. Due to COVID-19 restrictions, agencies and organizations throughout the state of Indiana and everywhere else pretty much have been able to provide immediate services for individuals and families in need. Individuals were therefore cut off from support systems and access to services throughout the state. Our current systems have been overwhelmed due to an increase in requests for resources during the pandemic, which left organizations and agencies throughout the state with great concern for the state's most vulnerable users. The Indiana Recovery Network and Mental Health America Indiana Regional Recovery Hubs have been created through collaborations with existing recovery support organizations throughout the state of Indiana. Organizations are currently utilizing peer supports in their various programs. Peer supports in these programs providing services are certified addiction peer recovery coaches, community health workers, and certified recovery specialists. These organizations have previous relationships with agencies and organizations within their communities. The regional recovery hubs will develop relationships through community outreach with agencies and organizations throughout their region. They will focus on underserved and marginalized populations and provide services and resources for individuals with mental health concerns and or substance use issues. The regional recovery hubs are grant funded, which means individuals can connect and engage with peers without any barriers. And the peers are community based. Regional recovery hubs will also do community outreach and form collaborations with justice systems throughout the state. These collaborations will include connections with the Department of Corrections, which will connect individuals with peer supports, pre- and or post-release, re-entry, parole, any of those types of services. They will also do outreach with county and community justice systems, such as problem-solving courts, re-entry, work release, and probation. Peers will provide support and assist individuals in accessing resources in their communities, and this will be statewide. So peers are available in all regions to provide a warm handoff for individuals who may be released from a justice system in one community and may need to relocate to another community in another area of the state. Community outreach and collaborations will also consist of opioid treatment providers, medicated assisted treatment providers, domestic violence survivor organizations and agencies who provide services for individuals experiencing homelessness. They also connect with the local coordinating councils throughout our state, recovery residents, community centers, learning institutions and environments, so pretty much anyone that provides services throughout the state for individuals in need of services for mental health and or addictions issues. So the referrals that the peer supports will be providing can include detox, treatment for addiction and mental health concerns, transitional housing, shelters, recovery residents, food pantries, clothing banks, recovery support groups, recovery engagement centers. These peers will be providing services through the Regional Recovery Hub and will meet with individuals to discuss and decipher what those resources will be to best meet that individual's needs. So for the sake of the Regional Recovery Hubs, the state has been divided into 5 regions. So here's the map to just give you a visual aid. We have the Northwest region, Northeast region, Southwest, Southeast, and Central region. Within each region, there are multiple hubs, and that provides comprehensive services and coverage within each region. Regional recovery hubs will communicate and collaborate with one another to provide services statewide. So now I'm going to give you just a brief description of each organization within the regional hubs. And again, you will see there are the organization's website or Facebook page if you want to connect with them or learn more about their services they provide. In the Northwest region, we have Integrative Wellness, LLC, or InWell. We have the Artistic Recovery and Phoenix Recovery Solutions, QRT. Integrative Wellness is located in Boone County, Indiana. They provide outpatient mental health and addiction services. They provide services to all ages, and they accept most insurance, including Medicaid and recovery wards. The Artistic Recovery is located in Porter County. They host a variety of recovery-focused programs such as art, music, physical activities, community engagement events, and life skills development classes. Phoenix Recovery Solutions, QRT, is located in Tippecanoe County, Indiana, and is a mobile integrated response team committed to assisting individuals, families, and communities with taking an integrative and innovative approach to solving severe opioid and other drug issues. In the Northeast region, we have Jay County Drug Prevention Coalition, Oaklawn Psychiatric Center, and Turning Point Systems of Care, Pick Yourself Up. Jay County Drug Prevention Coalition, located in Jay County, and is the designated local coordinating council in Jay County. JCDPC is focused on prevention and treatment of substance use disorder and utilizes peer recovery coaches to help individuals with all of their recovery needs. Oaklawn Psychiatric Center is located in St. Joseph County, Indiana, and is a community mental health center with locations in Elkhart and St. Joseph, where recovery coaching is offered. Pick Yourself Up Turning Point Systems of Care is located in Howard County, Indiana. They provide resources and support to individuals experiencing mental health concerns and or addiction issues. They believe that peer supports play an integral piece in an individual's recovery journey. In the Southwest region, we have Wabash Valley Recovery Center and Peacestone Inc. Wabash Valley Recovery Center is located in Vigo County, Indiana. They focus on education and advocacy regarding sustainable recovery supports and services. They provide individuals in addiction or recovery with access to services and resources through certified peer supports. Peacestone Inc. is located in Vanderburgh County, Indiana, and they provide valuable programs and recovery tools, including mental health and/or addiction support groups, peer support services, art empowerment programs, poetry, journaling, and a gardening group, as well as wellness workshops. In the Southeast region, we have Scott County Thrive and One Voice. Scott County Thrive is located in Scott County. They are a recovery community organization, and it is a community-based peer support organization, meaning services are not tied to any specific provider, which helps ensure that all individuals seeking services can engage in supports without restraints. They have opened a recovery engagement center where they offer peer support services. Peers also serve as a resource officer for any needs people may have. One Voice is located in Dearborn County, and they are a grassroots recovery community organization that advocates, educates, and raises awareness on addiction and recovery support services. They provide networks and collaborations with communities to better support a recovery community while fighting the stigma of addiction and building positive supports. In the Central region, we have Indiana Addictions Issues Coalition. Indiana Addictions Issues Coalition is located in Marion County and is a recovery community organization that advocates on behalf of people with addiction and mental health concerns with a mission to promote recovery through education and peer support services. Ways that you can connect with the Regional Recovery Hub in your area. So we have recently released some marketing materials that will start being distributed in communities and regions throughout our state. Each informational piece will have the organization in that region's logo, as well as contact information. You can also connect with a Regional Recovery Hub through the Indiana Recovery Network website, and that's indianarecovery.org. On our website, you'll see a connect to a peer link. You can click on that, and there is a brief electronic information form an individual will complete, and in that form they will identify the best way for someone to connect with them, whether it's email or through a phone call. Once that form has been completed, a certified peer will follow up with that individual within 24 hours. And depending on where that individual is located, the peer will provide a warm handoff to a recovery hub nearest that individual. If you would like any additional information on the regional recovery hubs, you can contact me directly at my email address. It's hrodriguez@mhai.net. You can also find all the organizations listed through the Indiana Recovery Network under the Recovery Organization link. There's also a new resource link for the Regional Recovery Hub project where you can contact the organizations directly. Thank you for your attention. Have a great day.